Go ahead.
All right, so we're going to revisit the anatomy of the arteries and veins of the lower extremity. First thing I want you to remember is the orientation of the arteries to the veins. So typically the veins lie on the medial side of the leg on either side. So if you're on the right leg, this would be the vein, this would be the arteries. If you're on the left leg, again, the veins are on the medial side. So we're going to start from the aorta and draw the arteries of the leg. So the aorta should bifurcate into the two common iliacs, which then bifurcate into the external and internal iliac. And at the level of the inguinal ligament, which is basically the crease in the leg, is where we're going to start our imaging. So you have to position your transducer. Again, all your vessels lie on the medial side of the leg. So you're going to position your transducer where you're pointing your notch towards the opposite shoulder. And you want to make sure that you angle up far enough so you can actually see the external iliac. So we start about here. It becomes the common femoral artery. And right up here in the groin, it bifurcates into the, and I'm going to use the dotted lines to show the deep. This is the deep profunda artery. And this is the superficial femoral artery, which courses all the way along the medial side of the leg. At this point here, it drops into an area known as Hunter's Canal or Adductor's Canal. And then it continues its course behind the knee as the Popliteal artery. At this point, it makes its way back up between the two bones, the tibia and the fibula, and the first branch that takes an anterior and lateral course down the leg is the anterior tibial artery. This courses all the way down the leg and then courses over the top of the foot to become the dorsalis pedis. Okay? At the same time, so basically bifurcates. They might say it trifurcates in the book, but it bifurcates. So we have the anterior tib is the first one. And then behind the knee, okay, so the anterior tib came off that way. You have what's called the tibio-peroneal trunk. At this point, the one that courses right down the center, the deep one, is the peroneal. It courses alongside the fibula bone. Typically, we can't see it, or we can see it, but it's always the deeper one. And then it splits into the posterior tibial artery. Okay, so the tibio-peroneal trunk splits into the posterior tib and the peroneal. The peroneal, again, is basically right in the center of the calf. So if you're scanning on this side and you see a vessel, it's the anterior tib, and then the deeper one's the peroneal. If you're on the medial side, you're going to see the post tib, and then the deeper one's the peroneal. Now, the veins that we consider the deep veins, which are under the muscle, below the fascia, share a partner, basically have the same name as the artery, but they lie just medial for the most part. So starting back up in the groin again, we have the common femoral vein. And unlike the arteries, there's two superficial veins that we image. And what makes a superficial vein is the fact that it courses above the fascia, just below the skin. So the very first branch that comes off is the greater saphenous vein. It courses all the way down the medial side of the body. It's the longest vein in the body, and it's often used for bypass surgery. So sometimes if you work somewhere and they do vein mapping, they're typically mapping the greater saphenous and making marks as to where the valves are, so they know if it's a good segment to use or not for bypass. So that's not going to have an artery that accompanies it. So the superficial veins travel alone. Now the deep system, again, we have the common femoral artery, and medial is the common femoral vein. And then just a little further down from where the arteries split, the veins split into the same name or paired vessels. You have the deep profunda vein, and you have the superficial femoral vein. Now it has the name superficial femoral, but it's still considered a deep vessel because it's between the muscle and below the fascia. Like the artery, the vein dives down through Hunter's Canal or Adductor's Canal, And under the knee, behind the knee, and the popliteal fossa, it changes its name to the popliteal vein. And just like the arteries, you have the same calf vessels. The only thing that's different is there are 2 veins for every deep artery. So before we get to that, the lesser saphenous, which is the second superficial vein, comes off here, and it courses right along under the skin, right along the very back of the calf. So you have the greater saphenous and the lesser saphenous. Those are your 2 superficial veins. Then it bifurcates, okay? And you have 2 anterior tibial veins, one on either side, typically, okay? And then on the other side, we have that tibio-perineal trunk, again, where it splits into 2, sorry, Emily, perineal veins. She didn't know she was getting a pretty tattoo today. And then 2 perineals. I won't destroy your leg with that. Okay, so that's basically what we're going to be imaging. Now, in your packets, if you look, there's like cross-sectional cuts, and it's easier to find the calf vessels when we start off transverse, and I'll show you what that image looks like. But that's basically some of the key things. So a couple of things to remember is the veins are going to lie medial to the arteries. The other thing to remember is the veins have 2 additional vessels, the superficial vessels that lie just under the skin and above the fascia. Every deep artery has a deep vein that shares its name. Okay, the point where they dive down into the popliteal fossa is Hunter's canal or adductor's canal. The other key thing to remember is that the 2 vessels that share the tibio-perineal trunk are the posterior tib and the perineal, which sometimes is referred to as the fibula because it runs right alongside the fibula bone. And then, of course, you have the anterior tibial arteries and veins, which take an anterior course through the 2 bones and then a lateral course down the leg. And what happens when they go over the top of the foot, they change their name to the dorsalis pedis. Okay, so that hopefully that helps.